What kind of help is available for people at the breaking point, for their families? Could it have saved the lives of all those who died? Phil Shuman is here with that part of the story and also with an update on the gunman. Phil.
Well, that's right. He fired 100 rounds. He shot his dad multiple times in the chest, his brother once. Still nothing from the mother, in seclusion, no doubt in shock, as you might imagine. So today the question, what if? What if Zawahiri reached out for help? Would it have made a difference? The experts we talked to believe it would have.
Suicide Prevention Crisis Line.
Yamile Sanchez is saving lives, one phone call at a time.
What's going on today?
She's one of the trained counselors answering hotline calls at this 24/7 suicide prevention and crisis center.
We de-escalate callers who are frantic, who are crying, or just letting them know that someone is there to listen to them and just to talk things through.
There's still much to learn about what pushed Santa Monica's John Zawahiri over the edge, killing, burning his father and brother to death, shooting 3 others before dying in a gun battle with police. But what we do know is that there is help available for him, for anyone. The many numbers, the many resources are just a web search away. And it doesn't have to be a phone call. You can chat live with a crisis counselor. There are even programs being developed to text for help from your cell phone. The point is to reach out to someone.
I think crisis lines are effectively becoming probably the baseline of the safety net so that we can assist them in addressing that.
Robert Storr has been in the mental health business for 20 years. His organization alone, the Didi Hirsch Mental Health Services Hotline, receives 52,000 calls a year, and the number's going up. The most common issues: suicidal thoughts, mental illness, family conflict, relationship issues, financial stress. Again, the idea is to de-escalate.
De-escalate means to take an individual that's in a crisis that would have normally nowhere to turn or nobody to talk to, and to be able to provide an environment that's safe, confidential, warm, caring, so that they actually can begin to calm down, think rationally.
The idea, I think, is to provide them resources if necessary, but to hear them out and provide that safe environment. We often don't want to share our thoughts or our feelings with other people because we are fearful of being judged. And so our goal is safe environment, confidential, no judgment.
It's a challenge to get those in crisis or their friends, their family members to stop, think, make a call. But it happens and it helps. People need to know they're not alone. So there are a lot of hotlines. That one, the county runs mental health hotlines. There are national hotlines, suicide prevention lines. They all essentially do the same thing, that term de-escalate. And they want to let someone know that there's help available, steer them to resources, counseling. Of course, if there's an immediate threat, like the other day, it would be call 911. You remember that's what the counselor that took Paris Jackson's suicide call did last week, and her life was saved by paramedics. So point is, there's help available. It doesn't matter if you can pay, it doesn't matter who you are, but you got to reach out.
And like they say, see something, say something, even if it's about somebody else. Phil, thanks very much.